Helping you live healthy. A recent study from American Heart Association shows heart disease awareness is down among young women and women of color. In fact, in the last decade, overall awareness declined more than 20% in all racial and ethnic groups and more than 80% in women between the ages of 25 and 34. Joining me now is Dr. Demilade Adedinsewo from Mayo Clinic. Thank you for being with us this morning.
Thank you for having me.
And why do you think that awareness about heart disease is down?
So it's unclear as to why this is the case. The recent study, like you mentioned, identified this, and we think that there might just have been, over time, people are just less informed about the risk of heart disease, and that heart disease happens to be the leading cause of death. It's the #1 killer among women in this country. Just to put it in some context, heart disease was responsible for about 300,000 deaths in 2018. That's 7 times higher than breast cancer.
And those numbers are really staggering and startling to hear. With that being said, why is it so important for women under the age of 65 to be aware of this disease?
So it is really important because awareness would lead to promotion of healthy habits. And the earlier you start these healthy habits, the better the chances of reducing your risk of cardiovascular disease over time. Young women are particularly at risk because in this study, they had the lowest level of awareness. And we want them to know about this so they can start heart healthy habits early.
Why is being aware of your blood pressure so important as well? And what should women really know about that?
Okay, so high blood pressure is also referred to as hypertension, and it's a key risk factor for cardiovascular disease. I should also mention that high blood pressure or hypertension usually does not have any symptoms. This is why it has been dubbed the silent killer. Being aware of your blood pressure, the only way to know is by measuring it. So you can measure your blood pressure at home, or you can have it checked at your primary care doctor's office, so that if you have high blood pressure, it can be diagnosed early and appropriate treatment can be started.
Are African American women at higher risk for high blood pressure, and what can they do, if so, to reduce their risk?
So studies have shown that high blood pressure tends to be more common amongst African Americans, and there are multiple things that you can do to reduce your risk. I would like to use this to emphasize the American Heart Association Life Simple 7 metrics. There are 4 behavioral factors and 3 health factors. So for the 4 behavioral factors, we talk about smoking cessation, maintaining a healthy weight, physical activity, and a healthy diet. And for the behavioral factors, the clinical factors that can help you reduce your cardiovascular risk, we talk about checking your blood pressure, talk about checking your blood cholesterol, as well as your blood sugar.
And you mentioned things like exercise and healthy eating. How much of a difference can those simple things make when it comes to heart health?
Oh, a significant difference. Lots of study has shown this, and that's why the American Heart Association came up with this metrics. We call them metrics of ideal cardiovascular health. And if you're able to achieve the set cut point for each of these 7 things that I listed, then you dramatically reduce your risk of cardiovascular disease.
And for people listening, what are the symptoms that women should be looking for?
So when it comes to heart disease, the symptoms can be broad. So I'll pick one in particular, which is a heart attack, which is what a lot of people are worried about. The most common symptom of a heart attack is still chest discomfort in women and also in men. Chest discomfort can present as chest pain, chest fullness, or chest pressure. There are some other atypical symptoms that women can experience, including shortness of breath, pain in your arms, pain in the neck, or pain in the jaw. So if you're feeling unwell, or if something doesn't seem quite right, or you develop any of these new symptoms, it's better for you to call your primary care physician or call your doctor as soon as possible to make sure that you're checked out.
A lot of really great information. Doctor, thank you so much for being with us this morning.
Thank you so much for having me.